So welcome everyone tonight to Accredited Health Coaching Australia's webinar Mastering Behaviour Change. This webinar tonight is to give you an insight into health coaching and health behaviour change training and courses that we offer, and also to introduce you to myself, Sharon, and our company if you haven't met us or heard of us before. So on that note, I'm going to get Sharon to introduce herself.
So my name's Sharon Curtin and I'm a dietitian and a health coach. I spent about 6 years working in the public health systems. I worked in lots of inpatients, outpatients, diabetes clinics, and I absolutely loved it. The trouble that I found was, as much as I loved education, I would always have clients who knew what to do and still didn't do it. And so I used to think, what else can I do? I need to be a psychologist. So then when I discovered health coaching, I knew that this was the missing piece. So I started to study health coaching, and what I realized was there was a real lack of Australian-based credible health coaching courses. I think, being a dietitian, my level of requirement for evidence-based was quite high. So I ended up developing the Diploma of Health Coaching, which is running with Victoria Uni Polytechnic at the moment. I also had to learn to be a certified trainer and assessor, which is fantastic. And I also got to meet Siobhan, which was probably the best part of it all.
Thanks. So in terms of that, I met Sharon through the diploma. I did some writing for Sharon, and that's how we met a couple of years ago, and we formed Accredited Health Coaching Australia this year. My background before that, I've been a health coach for close to 10 years now. I'm a certified health coach and I'm a professional member of Health Coaches Australia and New Zealand Association, HCANSA, which is the governing body for Australia and New Zealand. I'm also a certified trainer and assessor as well, and accredited practicing dietitian, have been for about 17 years, accredited nutritionist. I'm the director, as I mentioned, of this company, and also the director of my private practice, which is Discovery Health Coaching. And I'm also the vice president of the Australasian Society of Lifestyle Medicine. And some people may know of that already who are on the call. That society is a group of allied health practitioners, medical practitioners, nurses, public health professionals and academics that are all working together to help change the health of people on an individual level and also on a larger sort of societal and public health level. So tonight, what we're going to run through is an introduction to health coaching, integrating health coaching into your practice, communication techniques to motivate change. We're just going to touch on, obviously, just a little bit of that tonight. We can't go through too much, but just enough to give you a few takeaways. Courses that are offered by us, how to become a nationally recognised health coach, and any questions that you have about health coaching we will answer at the end. These are statements that are commonly called excuses, but they're essentially statements of why someone can't change or finds it difficult to change, or what the barriers are, etc. So these excuses, I guess, or statements, they usually come from our influences on behaviour change. So whether they be external or internal. So external things like physical environment, social influence, internal being things like thoughts, beliefs. And these influences on behaviour change can act as barriers or challenges, or they can act as facilitators. Obviously, if you look at social aspect, you can have people that support you and, champion your efforts and want to, go for walks with you, etc. But you also may have people that are saboteurs, and that may, encourage you to go back to old behaviours or not change a behaviour. So with coaching, what it does is it helps you not only manage what to say to statements like this and how to communicate with people and get them unstuck, but it also helps coach around these influences in terms of knowing how to handle these barriers and challenges and how to enhance things like facilitators. This is fundamentally my belief, and I think health coaching skills and health change skills, health communication skills are essential for every health practitioner, especially ones that are in the business, which the majority of us are in the business of helping someone to change and maintain good health, and in the business of lifestyle-related diseases, prevention, management, treatment. So I really think with health coaching, it just makes us a better health professional. I think once I went through it myself, I'm a much better health professional than what I was previous. So I just think it's never too late, no matter where you are in your career. And sometimes people do health coaching and they've been out 20, 30, 40 years. Other people are doing it earlier on in their career. But I think at whatever stage you're at, I have the belief, and I've seen people go through it and they just feel so much more confident and happier and enjoy their careers so much more. And this is why we developed Accredited Health Coaching Australia. We both believe that it helped us so much in our career, and we loved health coaching when we discovered health behaviour change, and we loved the experience that it had both in our careers with our clients or patients. And we also really felt like all health professionals should know this and should have the support to actually be confident with their communication in practice. So I'm going to hand over to Sharon to explain a little bit more, and then I'll take over in a bit.
Yeah, so I guess what Siobhan and I noticed was there's this massive gap in training for health professionals. So there's a lot of short courses you can do, but I don't know if anyone here has done some short courses, but you spend a weekend doing something and then you feel so completely excited about the skills and overwhelmed because you can't put them all into practice. So by the time a week goes by, you're really not solidifying all of that incredible knowledge that you've learned. So we developed Health Coaching Australia, Accredited Health Coaching Australia, because we know that you need a length of time to put these skills into practice. And we just knew that because we both had to learn health coaching before there was any sort of one in course, we know how to teach people how to be health coaches because we had to learn it the hard way. So we are super passionate about training everyone in these health behaviour change skills because we know what a difference they make. And we know that we're really hitting our heads up against a brick wall trying to operate in the old model that we know doesn't work for long-term change. So we developed our courses in conjunction with the International Coaching Federation criteria that's used by Health Coaches Australia and New Zealand Association, or HCANSA. So there's a few terms that get bandied around: certified health coach, credentialed health coach. Before HCANSA, there was no yardstick for measuring a health coach. You could, be a whatever. You could be a mum who's really excited about health and fitness, and you could call yourself a health coach. I certainly started out being a dietitian who thought I could be a health coach, and then I realised health coaching skills are quite specific. And if you don't learn them, you actually can't call yourself a health coach. So fantastically, in came HCANSA, they introduced this international gold standard of coaching. So they've now got a way to become nationally recognised as a health coach. They've got a professional membership. So once you meet the requirements of a professional membership of HCANSA, you can call yourself a nationally recognised health coach at the professional level. Siobhan and I are both professional level. You can also join as an associate member, which is where you have an interest in health coaching and you're already using some health coaching principles and strategies in your practice. But it's really important, whatever you do, that if you are going to do some training, that you make sure that it's aligned with the HCANSA competencies. And that includes 40 hours of live synchronous learning. So you can't study health coaching online. I mean, that makes sense. You can't study how to coach by watching other people coach and not having any interaction, not having any feedback, not coaching with peers and having a trainer give you some insight and help you to, self-reflect and improve. So part of the HCANSA criteria is the 40 hours. You need experienced trainers. So the trainers have to also pass the same requirements. So the trainers have to be professional level members. And so that's all of the things that we've considered when we've created our health coach training courses. So when we were talking about the type of things we find frustrating earlier, we were talking about these ambivalent clients. So our clients who struggle with change, they're the ones who seem really unmotivated or they're stuck. They've got a boot in both camps. They're all talk, but no action. Yeah, I know I should. I really know I should. Yeah, I'm going to do that. I'm going to do that. And then they don't. They say that they really want to and it's really important to them, but they still don't make the change. And they don't seem to be responsible for their own life. It's all about you and what you think they should do. And despite all of this fantastic education and advice that we give them, they still ignore the risks, or they seem to be ignoring the risks, and they don't seem to be recognizing the benefits, or they don't seem to feel that the benefits are enough to make them change. What we talk about a lot in the Accredited Health Coaching Australia courses is this concept of understanding where your client is at, what is their readiness to change, because ambivalence is completely normal, and frustration is also normal. The frustration comes from our expectations. So when we want change to happen quicker than it does, we can get really frustrated. But really what we need to understand is that our clients are just ambivalent, and ambivalent is a completely normal part of our behaviour change cycle. So as soon as we understand that our clients are pre-contemplative and they're not even considering change, or that they're in contemplation and maybe it's going to take 6 months before they take action, and they're still weighing up the benefits versus the effort it's going to take. Preparation is also where they've started to take action, and we can think, what are they doing? They've been to the gym now. Like, why can't they just keep it going? But this is completely normal. And once we take our expectations away from they should be doing things now, and we just understand that we just need to move them from pre-contemplation to contemplation, or from contemplation to preparation, that is the way that we unlock those secrets to behaviour change. So how do we know if our clients are ambivalent? Well, we can tell by the things that they say. So someone in pre-contemplation is not even thinking about change. It's not on their radar. And they're saying, I don't want to give up smoking. I don't need to drink less. It's okay. Drinking a bottle a night is fine. Look at me, I'm fine. Now, they can also think that it's very important, but they can think that the barriers are far too high. There is no way. So I could never give up coffee. I don't know how I would get through a day without coffee. So that's that real pre-contemplative client. Then we've got contemplation. Maybe they might change in the next 6 months. And they're going to say things like, I might. Yeah, I might. I'm thinking about it. So then we know, oh, okay, they're in contemplation. They're still weighing it up. Then we've got our clients in preparation. So it's probably likely that they're going to take action in a month. And they're going to go, yeah, I will. I'm thinking I'm going to go to the gym. Yeah, I'm going to go this week. I'm going to go get that timetable. Maybe I've downloaded some recipes. So they've started to take action towards their goals. And as soon as we can identify which stage of change they're in from what they say, we can start to change our communication strategies, and we can also help them set goals that are appropriate for their stage of change.
So what do you do when someone is not ready to change? So when clients are ambivalent, things that we commonly do, and this is common in the traditional approach or medical model, is provide more information, advice, or persuade and remind of reasons to change and risks of staying the same. However, when you've got an ambivalent client that are weighing up the pros and cons, it's kind of like being on a seesaw. So if you provide the reasons to change, naturally someone is going to provide the reasons to stay the same, so it evens it out. And if you think about yourself, say if you're contemplating changing something and you express it to maybe a loved one who wants you to change, and you say, look, I'm really thinking about, exercising. I know it'd be good for me. And the loved one says, yeah, that'd be great. You've been wanting to exercise for ages. I'll go with you, and provides all these reasons about why you should do it. If you're ambivalent, you'll naturally say, yeah, but I'm busy with work and I've got a lot on. And so you naturally back down because you're not actually there yet. You're not ready to change. So this is a situation that can happen in our clinics and our practice, where we feel stuck, or the client feels stuck, when we are providing all the reasons why they should change, and then they naturally are getting the balance even by providing the reasons why they should stay the same. Ultimately, when clients are ambivalent, the motivation needs to come from within. People are generally better persuaded by the reasons which they have themselves discovered than by those which have come into the mind of others. So motivation literally is motive. If something's important to us and we have the confidence in our abilities and the skill set to be able to do it, we will do it. So if you think about now what you value, and these are just some examples, like whether it's being a role model for staff, children, grandchildren, what does that make you do in terms of your behaviours? If you want your children to eat their vegetables, does that motivate you to eat the vegetables? If you want them to be active, does that motivate you to do family walks? You know, what is it that you value that then motivates your behaviours? Ultimately, by getting motivated, it's about finding our why. So those reasons linked to change and linked to our values. So our goal as health practitioners is to elicit motivation for sustained change. So it's literally helping someone find and connect to their autonomous or intrinsic motivation. So as opposed to extrinsic or external motivation, which is like the carrot and stick model, so that praise, reward versus punishment, or telling off. So that can work obviously in the short term. So someone might want to do the right thing by you because you're praising them, or they want to avoid you telling them off, or they might join a program because there's a reward or an incentive. But ultimately, if you remove that external motivator, so they don't come and see you anymore, or the program stops, and people can drop back to their old habits and old behaviours, unless they've actually moved forward to that autonomous or intrinsic motivation. So that motivation, doing something for the sake of the behaviour because it's important, of deep value, or it's connected to something that we value or our identity. Also, if you can help someone to imagine a better future, a better self, then this also can motivate someone to do something for the long term. So there's a couple of questions we've put together here at different stages of change. So in pre-contemplation, so that's someone that's not considering change. Maybe they've been referred into your practice, they're not sure why they're there, or they're sure why they're there, they know why they're there, but they haven't considered changing or are not willing to consider change. So the first thing that we would do is validate and acknowledge their control. So, that's absolutely fine that you're not considering changing at the moment, and ultimately it's your decision to change. It's your life, and I'm here to support you in whichever way I can. We ask permission to have a conversation. Would it be okay? We've got 15 minutes here today. We've got half an hour here today. Would it be okay to have a chat around the topic and just see if, what comes up? You can ask questions like, what actually is important to you, and what do you value in your life, and what matters to you? And having a conversation around that, it may lead to a question where you can connect health to that value. So, how does your health affect what matters to you most? Potentially, you could ask this question, if your condition deteriorated, in what ways would it affect your life? Or have you considered what ways it may affect your life? Would you be open to having a chat about your condition, diagnosis, risk factors, and how they relate personally to you? So it's always about giving that permission, being client-centered, and again, validating that they haven't come in ready to change, or even saying that they're considering change. So literally we're saying, would you be open to having a chat about this? Potentially looking at, what would they like to do in the future and how their health could help them. So getting them to think forward and considering, is what I'm doing right now, will my condition affect what actually matters to me and where I want to take my life? So contemplation, so that person is obviously considering change. They're weighing up the pros and cons, but they haven't started to change yet. So the first thing, again, is always validating and acknowledge their control. So, you're considering to change, but not sure. The decision to change is ultimately always up to you. I'm here to support you. And then you can ask some questions around what actually is important to them about making a change. So they started to think about it, so they actually have been weighing up some of the benefits or the pros. So getting them to explore that can move the conversation forward. Thinking about the future, so how will your health help you achieve your ideal life? In what ways does your health affect what matters to you most? So again, anchoring to those values. How could this behaviour make you feel good? So getting them to visualise once they've started the behaviour, how are you going to feel? Or if they've done it in the past, you can get them to reflect on, how did you feel when you were doing that behaviour all the time? Imagine sometime in the future, for example, 3 months, and you have been maintaining the change, you've been doing the change, how would you feel? And again, this is to get someone imagining themselves in the future and getting excited about that change. So preparation, so preparing to change, they're not fully changing yet. They might have done a toe dip and they might have started some exercise and then gone back, or they might have got the gym pass, got the sneakers, got the exercise gear, but they haven't quite started yet. But essentially, they're preparing to change sometime in the next 30 days. Firstly, affirm the decision to change. So that's great that you've decided to change. How does that make you feel? What are the most important reasons for wanting to change? How will you feel like once you've achieved the change? So you're building that positivity and that excitement about change. What will help you to get started? So literally getting down to those step-by-step approaches so they can visualize what are the steps that it's going to take to get started. What will help you to overcome barriers or challenges when they arise? The confidence goes up if they know that I've got a plan to address barriers or challenges if they come up. Who or what will help you to keep on track? Is that social support and those facilitators for change? And how can I support you as your health practitioner? So what happens when someone says that change is important to them, but there are still those excuses coming up? So they're still ambivalent. So change is important to me. I don't know what to do, or I tried last time and it just didn't work out. So things that we commonly do is we try to devise solutions for our clients. So we try to come up with evidence-based actions, what might have worked for us personally or our clients, ideas we've heard or seen. But if we jump straight in, it's like us grabbing the wheel while someone's trying to drive. So we're trying to actually direct the journey towards the destination. So that removes autonomy and self-responsibility and client ownership of their own journey, as opposed to us being there in the seat next to them saying, what way would you like to take? What journey do you think it's best to get to the destination? What would make you most happiest? What would feel easiest to get to your destination? So the ways that we can help our client to brainstorm all the possible solutions and strategies, we can ask them things like, what could work? Or what have you already thought of trying? What are some new possibilities? Or what are you willing to try? Or ask them to reflect on their past in a positive way. So, what's worked in the past, or even if things haven't worked, what have you learned about yourself from previous attempts that we can put into place going forward? And obviously supporting them to create a plan to tackle challenges and strengthen facilitators. So, what is holding you right now and how could you get around this? What are the triggers for your current behaviours? Are there ways to perhaps remove or respond differently to the triggers? Who or what could help you get started or stay on track? Who may sabotage your efforts and how will you deal with those influences? So that might be obviously a social setting. Do I hang out with those people a little less than I would normally in the early stages of change? Or how can I meet them in an environment that doesn't have my triggers? Or what can I say to those people to stay strong and stay on track? And in what ways can I support you, again, as your health practitioner with your confidence? So we're going to do a live demonstration of health coaching in action. This is not scripted. We're going to do 2 demonstrations. The first one is a demonstration of more of the traditional approach, the medical model, the advice giving approach. And the second model is health coaching in action, so a health coaching demonstration. Sharon is going to coach me on an area that I have been contemplating changing for a while, and sometimes I move into preparation action, then I flick back into contemplation. All right, so I'm going to stop my screen.
I'm just going to change our view. Okay. All right, what would you like to talk about today?
I would like to talk about getting to bed a little bit earlier. I'm a notorious person for getting to bed too late, whether it's due to working or whether it's due to watching TV or reading a book or lots of different reasons. But yes, I'd like to get to bed a little bit earlier.
Okay, well, that's great because sleep is so important. So it's really, really great that you've recognized that. Um, so, I think one of the things with sleep is having a really set bedtime. So I think one of the things that you should do is think about a time that's good for you to go to bed. So, you need 8 hours. So I guess working back from whatever that is, and probably around 10 o'clock might be a really great time to set an alarm and make sure that you go to bed at the same time every night. That would be a really great place to start.
Um, yeah, I don't know about 10 o'clock. I'm actually probably at the moment it's somewhere between 12 and 1 that I get to bed. So 10 o'clock seems like a
Ooh,
big stretch. Mm,
okay,
yeah.
that's really late, isn't it? Yeah, that's
Yeah.
that's super
I'm a bit of
late.
a night.
So, I mean, you must be very tired the next day. Do you not find that your day just doesn't run very well if you go to bed at 12 or 1?
Yeah, yeah, and I've been a bit run down lately, and yeah, no, I don't feel great about it. And I know as a health practitioner, you have that
Yep.
whole I should be getting to bed a little bit earlier and getting more sleep. But
Mm.
busy woman. I have a child and a couple of businesses, and uh, often I'll go back to the computer after I put my daughter to bed, and then sometimes I feel like I want to wind down, so it just suddenly becomes midnight. Yeah.
Yeah, yeah, I get it. I've got kids too, and I know how tempting it is that night time to sort of do those few emails and get that time to yourself. It's so bad for you to do that sleep. The impact on your day the next day, your mood. I mean, your mood must be flat. Um, you know, I would really, really suggest that you make a time that seems achievable. I think at 11 o'clock would be the absolute maximum that you should really aim to get to bed, and then have a really nice nighttime ritual, maybe something that you can look forward to. I found that really helped for me. Something like a nice cup of tea and a meditation. I can send you a great meditation app. I've got this fantastic one that I've really loved. Or a book. Have you read the Ariana Huffington book? I mean, it's such a game changer when it comes to really understanding that it's so important for us to get enough sleep.
I haven't read the book. I do have herbal tea at nighttime already,
Right?
and I do read. I have a
Yeah.
Kindle and quite a few books on the go, so I definitely do that. I have dabbled in meditation before.
Mhm.
I haven't been doing it lately, and I know I do need to get back into that. It can be helpful at nighttime as well as during the day. I do a little bit during the day, but nighttime can be helpful. Yeah, I I could try. I don't know about putting a time like 11 o'clock. It kind of stresses me out putting an exact time on it too. Like I
Okay.
kind of feel like if I miss the time, then I get more stressed, and then my sleep just doesn't happen because I can't. I'm not a person that just lies down and falls asleep straight away. Like I have to really chill out. I know you're talking about methods to
Yeah.
chill out, but
Yeah.
yeah, I don't like putting a line in the sand necessarily.
Okay.
I don't know. Sometimes I don't know. Mm.
All of the studies around sleep are they're very certain that it's about having a set bedtime that's the same all the time, and then having that really good sleep hygiene. The blacked out room, um, the pre-bed routine that makes it really so your body is prepared to go to sleep, so it really
Yeah, yeah,
understands the steps, so it knows that it's getting ready for sleep as well. um,
yeah.
so I
I'm
think
pretty much aware of that. I'm like a lifestyle medicine practitioner, and I know. Yeah,
yeah.
sorry to be rude and interrupt, but I know about the science.
Yeah, well, as you know, so you know the science, and the science says that they're the things that really help. So what are you thinking this week? I'm thinking um, maybe a maybe a great place to start is just by deciding that bedtime, and maybe starting with that, just one bedtime that is the same every night. What do you think?
Yeah, sure. At
Yeah,
this point, I feel like I
great.
want to end the consult, so that's all good. Yes, sure. One night.
One night, let's do it. Great. I love my plan. My plan is amazing. It's worked for me. It will work for you too. That is the way a traditional consult can go. Now we're going to do take two, and we're going to do it more from a health coaching approach.
Good, because my blood pressure went up then.
I love my ideas. No. All right. So, Siobhan, what would you like to talk about today?
I'd like to talk about sleep. So getting to bed a little bit earlier, and I've been in a bit of a habit of going to bed late. It changes sometimes. Like sometimes I get a little bit better with it, but it's crept out late again recently, and then I've become a little bit run down with it. So I feel like I need to pull it back in again and get to bed a little bit earlier than what I've been doing. Yeah.
Okay. And so why is going to bed earlier important for you?
Going to bed earlier, I just feel better, to be honest. I feel like the later I get to bed, and even if I get the same amount of sleep, like even if I sleep in a little bit longer the next day, I don't feel as good getting to bed a bit later. So it's a combination of getting adequate sleep, but it's also something about making sure that I'm in bed asleep before midnight. Makes a difference with my energy, my mood. I just feel more productive too the next day. I can get up earlier. I feel more on top of things. I feel ready to hit the ground running. Yeah, it's important from a lot of perspectives, really. Yeah.
Yeah. Okay. So if you had to give it a number of importance from 0 to 10, where 0 is not important at all and 10 is super duper important, how important is going to bed early for you at the moment?
Well, I'm feeling really run down. So it's actually it's gone up a notch. It's probably around like a 9 at the moment because I've just run myself into the ground and I'm feeling a little bit, yeah.
Okay. So it's
and as a health practitioner with my values, I kind of feel, like you feel a bit uncomfortable sometimes as a health professional when you have a behaviour that has gone a little bit out of whack.
Yeah. Okay. So it's really important to you both for how you feel, but it's also important to you on a value level because you want to feel like you're practicing what you preach.
Yeah, correct. Yeah.
Okay. So you've thought about this a lot. You've done a lot of different things before. What works? What have you found works?
Yeah, no, I have done this before. And so what works for me is I need to get off the computer by about like no later than 9:30 because otherwise I feel like I'm too wired and I'm just thinking about work for too long. I need to have some downtime after that. Like I'm not one of those people that get off the computer and go straight to sleep. Like I need to have a cup of tea. I need to wind down. Either watch a show if my husband's still up and about, or get on my Kindle and read. Do some stretching. I need to have at least sort of a good half an hour to an hour of wind down time, and then some time to get to bed, which involves stretching and shower and makeup off and all that sort of stuff.
Okay, so you've got a really good plan of what works for you.
Yeah, I know what works because this is a behaviour that I've been going in and out of for a while, so I do know what works. Yeah.
Okay, so what gets in the way then? You know what to do and it's really important to you. So what keeps you stuck?
What gets me stuck? Yeah, I think I might a few different things. I either get like hooked into something to do with work, or I answer emails too late, instead of just ignoring them and going, I'm going to answer them the next day. Or my husband he likes kind of very stimulating shows like action bang bangs or scary things that wake me up. But we'll start watching something and he will want to watch it for longer than what I want to watch it for because he can fall asleep straight away. So I need to sort of negotiate that we turn that off earlier than what we do. What else gets in the way? I think that whole, like when I have been working hard, sometimes the whole I deserve me time, that gets in the way, where I think, I don't want to just go straight to bed. Like I want to, watch something, or I want to read something, or So that gets in the way, and sometimes that can just creep out later and later. And I, and then I get into a pattern, and then I feel run down like I do this week, and I think, ooh, okay,
Yeah.
I have to pull in the reins again.
Okay, so you know what works. You you know what gets in the way. So what is your next step? What are you thinking that you would like to do so that you can get to bed earlier and not get run down and do all the things that you know you sort of want to do? What have you thought of?
I feel like there's a few steps there. I feel like I need to have I need to literally have some reminder that goes off at 9:30 that tells myself to stop working or stop looking at emails. So literally I'm going to write that down, that I put it in my phone afterwards, that I set a reminder on my phone that goes off every night at 9:30 on at least school nights. No, every night. Okay, every night. I've got a kid. Every night's the same. And then I think almost like that's a big thing for me. I think not checking the phone. So the reminder is get off the computer and stop checking the phone. And also social media as well. That's social media because I feel like that stimulates my brain too. So I don't want to look at that after 9:30. Then I think literally having a chat with my husband as well around the fact that I don't want to be watching anything scary past like 10:30 maximum, 10:15, 10 o'clock, 10:15, 10:30, absolute maximum. We need to turn that off because I need to have enough time to wind down.
Yeah.
So speak to husband about that. Yeah. Is there anything else I need to do at the moment? They're the main things, to be honest.
Yeah.
I think I'll have a think about it after this, but they're the main things. I know it's what keeps me up. It's the computer, the phone, the social media, and it's the scary stuff. And if I've got enough time to just unwind at that point in time, then I can fall asleep a lot quicker than having that stimulation.
Yeah, that wind down time sounds really important to you.
Yeah, it is.
Cool. All right. Well, we might stop that there.
We'll stop it there.
Before we go into any more action planning. All right. So we would love you guys to put some comments in the chat box about what you observed between the two different approaches. What did you notice about engagement of Siobhan? What did you notice about who spoke the most? And which one did you think was the most effective? Like we really want to hear from you guys and your observations. I'm going to use a coaching skill of silence where we don't speak until you write in the chat box. Telling versus enabling. Yes. Which one was telling, Chrissy? Yeah, the first one. Yeah. Listening is key. Absolutely. So how much did you think Siobhan enjoyed that first consultation? Siobhan, how much did you enjoy that first consultation?
Oh, I didn't. We've done these before where you've coached me on different things, but I don't know, particularly irritated me tonight in the first one. And you're a lovely person, but I just felt like I really didn't feel listened to, and I felt like you were just telling me what you do, or I get a bit annoyed too because I kind of felt like you weren't recognizing me as an expert, especially I'm a health professional too, so I kind of felt like I know that stuff, and you weren't really honouring what I knew. So yeah, we kind of made blood pressure go up a bit. Oh yeah, so we've got some more people commenting there. Yep. So open-ended versus closed questions. Yeah, there was definitely you asked me a lot more open-ended questions the second time. Second approach really got Siobhan to think about her values and reasons and find the answers rather than telling her what to do. Yeah, it was, you actually got me to think around like why, yeah, the big, why it's important to me, which is nice, empowering. During the second consultation, the patient was asked to make her own plans about the changes she would make. Yeah, exactly. So it kind of, I felt like I was owning it. Like I was coming up with my plan as opposed to Sharon telling me what she thought would work for her. Well done, ladies. Certainly latter approach was more effective, more open questions, empowering, letting the client think for herself. Yeah, absolutely. Client-led with the second one was so much more engaging, and client ownership, great to watch the differences in energy level of client change so much in the second one. Yeah, it was much more enjoyable for me, the second one. The second approach reminds me of the principles I learned in my training as a university teacher. Open-ended questions and asking the students to ponder and come up with the answers lead to higher quality learning. Yeah, absolutely. Like I actually was reflecting upon, I feel like I didn't learn anything in the first one. Like I was kind of didn't want to listen to you. Whereas the second one, I'm literally reflecting. So thinking about myself and what drives me and what actually does work and why I want to do it. Yeah. Listening to the answer in the first session, not allowing Siobhan to come to her own decisions. Yeah. And that was
I was particularly patronizing when I said, well, we all know what the science says, because, sometimes as health professionals, we're like, well, it's 5 fruit and 2 veg. And we really go back to that. I mean, I get quite offended when GPs talk to me. I'll say I'm a dietitian and they'll say, so in your blood, there's some chemicals. And I'm like, oh, can you stop talking to me like an imbecile? So really respecting your level of knowledge and, there was lots of, this is what you need to do. Just do it like this, not listening to what you tried before, when obviously you'd been doing this for a long time. So why wouldn't I ask you what you've done before? You're the expert in yourself. You know what you've done. Yeah.
This is a great question from Sharmila. What if allowing the patient to own their issue? Patient asks you for opinion and direction. Yeah, absolutely. And that's fine. Like there's 2 experts in the room, the client, the patient's the expert themselves, and you're the expert from a health perspective. If the patient asks you for your advice or direction or whatnot, with permission, we are able to give it. If it's the first thing they ask, I'll usually actually say, well, have you thought of anything, or is something worked for you in the past? Trying to get the patient to collaborate and to work with me to come up with solutions and strategies and ideas. But certainly we can say with permission, given the evidence-based approach, or these are some approaches that have worked for similar clients. Do any of these appeal to you? So it's two experts collaborating on a plan and strategies. The first session disengaged, second engaged and allowed ownership of choice. Yeah, absolutely. Yeah, there was a big difference between, I was definitely disengaged in the first one. To be honest, I just started to want it to be over, which is why I stopped it. Whereas the second one, I could have kept chatting to you because I was just starting to think about what works and what would work for me. So much more engaged.
I think we're also very good at pretending that we agree with someone when we don't. So I think we, as health professionals, we can think we're super effective and that our clients love what we're saying to them, because they'll be like, oh, great idea. Yeah, I'm going to write that down. Yep. Oh, yeah, I'm going to do that. When actually they're just sitting there feeling that you've completely not listened to them, don't understand them, and they're going to walk out and they are never coming back. But we're so polite. We're so used to going, yes, oh, great idea. Yes. Oh, I'll try that. I'll get the book. Thanks. I'll look up that app. And one of my girlfriends gives me her recipes all the time. And I'm like, thank you. And I'm thinking, I don't want your recipe. I'm never going to make it. So, but she thinks that she's wonderful and her recipes are amazing. So sometimes as health professionals, we think we're really effective because we've got really polite clients.
That can be a trick. But we like most people socially want to be polite, so it doesn't necessarily mean we're effective. Chrissy, asking for permission is pivotal to facilitating the patient client to take ownership, and and takes them back to their strengths and removes focus on deficits. Yeah, absolutely.
Yeah.
And there is also a cultural thing. In some cultures, people will nod and say yes to everything because it's considered disrespectful to question a health professional. Yeah, exactly. Yeah. All right. I'm just going to share my screen. Feel free to keep writing the comments if you want to, everybody. This is just a summary of the traditional approach versus the health coaching approach, which is more about that sort of telling, advising, the assumptions, the jumping in with the how to, because we're trying to help people. And sometimes we feel like it's quicker to just jump in with the, this is how you do, this is what, these are the reasons for change, this is how you do it. We've only got like time ticking, but it doesn't necessarily, it might get someone out your door, but it doesn't necessarily facilitate change. It doesn't necessarily honour their client knowledge or experience. And as Sharon said, so it could be a disengaged or pretend agreement that comes out of it. So we think we've got somewhere, but we haven't. Health coaching is the open questions, the silence, the exploring the importance, honouring the client's knowledge, experience, and much more engaged. Health coaching provides the tools and skill set to support people to change and maintain their health changes, helps you to tailor the way you communicate to help your clients or patients find their motivation, empowers your clients or patients to overcome barriers and find facilitators to help them succeed, empowers you to feel confident and enjoy your career, and makes a difference in clients, patients' lives and your own. And this is a little an email from a client that I got a few weeks ago, who I've just been working with for a few telephonic consultations. And this is really around, health coaching is really around mindset, and this is how important mindset is in terms of change. So actually I got this email, I think we'd had 2 consultations at this point. Thanks again for everything you have done. It's crazy how different my mindset is now. I'm not so mean to myself. I love myself much more. My feelings have improved. My spirituality has improved. Every aspect of my life is different. I don't feel so down. I just want to be active now. Love how even those around me have noticed. Some know about me taking this journey and some don't. It's just crazy how I never knew what my capabilities were until now. And I love that with coaching. It really is around changing up here. As opposed to just giving someone some solutions or strategies. It's really getting someone to have those aha moments and that deep understanding of themselves, which ultimately leads to someone having a much more content life, which is our end goal, really. Health is just a pathway to contentment. So coaching health behaviour change in clinical practice, as I said, it's just a toe dip tonight. It involves a lot of health psychology and behaviour change principles, models and techniques, skills and techniques from performance and development coaching, as well as the experience, knowledge and skills of the health practitioner. This is our contact information, so that's our email. Please feel free to email us with any other questions. We're happy to help. That's our website. You can find a lot of information about us and our courses there. Instagram, we're posting about health behaviour change and health coaching and tips and tricks all the time on there, so feel free to follow us. Same for Facebook and LinkedIn, often using LinkedIn to advertise about events and whatnot coming up. So feel free to connect with us there. We thank you for joining us tonight. It's been an absolute pleasure, and hopefully we'll see you within our courses or somewhere else around the future or on social media.
Yeah.